Gentlemen, imagine this. Tomorrow morning you wake up, step out of bed, and start your day like you always do. You walk into the kitchen, maybe make your tea or coffee, and everything feels normal. After all, you walk every day. You've been told for years that walking is one of the best things you can do for your health. So you've stayed consistent. You've stayed active. But then something small happens. You try to stand up from a low chair, or climb a few stairs, or turn quickly to catch your balance. And suddenly your legs don't feel as strong as they should. Not painful. Not injured. Just weaker. And that's when the thought hits you. If I'm doing everything right, why is this happening? Now let's be clear. There is no magic exercise that stops aging. There is no single habit that keeps your body strong forever. But here's the good news. There are specific, proven ways to support your strength, balance, and stability, and most men simply aren't doing them. Today, I'm going to show you exactly what's missing, and how to fix it safely. Let's start with what's really going on inside your body. What's really happening to your legs? Your muscles are not all the same. In fact, your legs rely on two main types of muscle fibers. The first type are endurance fibers. These are responsible for low-intensity, long-duration movement. Walking, standing, light activity. The second type are power fibers. These are responsible for strength, speed, and stability. Standing up from a chair. Climbing stairs. Stopping yourself from falling. Now here's the key. As you age, especially after 40, your body naturally starts losing muscle mass. This process is called sarcopenia. But it doesn't affect all muscle fibers equally. Power fibers, the ones you need for strength and balance, decline much faster than endurance fibers. And here's the problem. Walking mainly uses endurance fibers. So even if you walk every single day, your strength fibers continue to weaken. This is why so many men say, I walk daily, but I still feel weak. I stay active, but my legs don't feel stable. It's not because walking is bad. It's because walking is incomplete. Think of it like this. Walking keeps your engine running, but it doesn't strengthen your brakes or your control system. And when it comes to real-life movement, control is everything. Now here's the important part. This decline is not permanent. Your body can rebuild strength at any age. It just needs the right signal. And that's exactly what we're going to do next. The 3-step strength routine foundation. You don't need a gym. You don't need heavy weights. You just need simple, controlled movements that send the right message to your muscles. Let's start with step 1. Step 1. Activate your muscles. Stand. As you push away from the wall, your feet press into the ground. Your calves and thighs activate. This is your body preparing for stronger movements. Think of it like turning on the system before using it. Simple but very important. Step 2. Build balance and control. Now stand behind a chair. Place your hands lightly on it for support. Lift one knee slowly toward your chest. Not fast. Not swinging. Controlled. Hold it for a moment, then slowly lower it back down. Repeat 10 times on one leg, then switch. Now here's what's really happening. The leg you lift is working, but the leg you're standing on is working even harder. Your thigh, your hip, your ankle, all working together to keep you stable. This is the kind of strength walking does not train. And this is where most men get it wrong. They think strength is only about movement. But real strength includes control. Step 3. Train real-life strength. Now sit down in a chair. Feet flat on the floor. Arms crossed over your chest. Stand up without using your hands. Then sit back down slowly. This is one of the most important exercises you can do, because it directly matches real life. Every time you get up from a chair, you're using this exact movement. Now here's the key. Don't rush. Take your time sitting down. Lower yourself slowly, about 3 to 4 seconds. This controlled lowering builds strength faster than quick movement. If you can only do a few repetitions, that's okay. Rest and go again. Work toward 3 sets of 8 to 10 reps. If needed, use your hands slightly at first. Then reduce support over time. Transition. Now here's where things start to change. Once your muscles are activated, once your balance improves, once your body starts receiving the right signals, that's when real strength begins to return. But there's one more step most men skip. And this step is what turns basic strength into real stability. Now here's where things become even more important. You've activated your muscles. You've started building control. You've practiced real-life strength movements. But there's one missing piece that most men ignore. And this is the step that separates basic activity from real strength. Step 4. Build strength under pressure. Find a wall. Stand with your back flat against it. Now slowly walk your feet forward about 1.5 feet. From here, gently slide your back down the wall until your knees bend slightly. Not too deep, just a comfortable angle. Now hold this position. You'll start to feel your thighs working within seconds. That burning sensation? That's your strength fibers activating. Those are the exact fibers you've been losing over time. Start with 15 to 20 seconds. As you get strong, this is called static strength. And it's one of the safest, most effective ways to rebuild power without risking injury. No humping. No heavy weights. No instability. Just you, your body, and a wall. The complete daily routine. Now let's bring everything together. Do these exercises in this exact order. Wall push-aways, 10 repetitions standing knee raises, 10 each leg sit to stands, 3 sets of 8 to 10 wall sits, 2 to 3 holds total time? Around 8 to 10 minutes. That's it. No gym. No equipment. No complicated setup. Now here's what matters most. Consistency. Not intensity. Not perfection. Just consistency. Do this at least 3 to 4 times per week. If your body feels good, you can even do it daily. But don't skip the whole week and try to do everything in one day. Your body doesn't respond to bursts. It responds to regular signals. Common mistakes most men make. This is where most men unknowingly slow down their progress. Mistake number 1, relying only on walking. Walking is excellent for your heart, but it does not build strength where you need it most. Mistake number 2, rushing the movements. Fast reps use momentum. Slow reps build muscle. Control is everything. Mistake number 3, avoiding discomfort. That burning feeling in your muscles? That's not harm. That's activation. As long as it's not sharp pain, it's part of the process. Mistake number 4, skipping balance work. Strength without balance increases your risk of falling. You need both. Mistake number 5, inconsistency. Doing it once or twice won't change much, but doing it regularly changes everything. Lifestyle support stack. Now here's the truth most people overlook. Exercise is only one part of the system. Your body works as a whole. If one part is weak, the others struggle too. Let's break it down simply. Sleep. Your body repairs itself while you sleep. Muscle recovery, hormone balance, nervous system reset, all happen during rest. Aim for 7 to 8 hours. Think of sleep as your body's repair mode. Movement. Daily movement keeps your circulation strong. Even light walking helps deliver nutrients to your muscles. But remember, walking supports your system. It doesn't replace strength work. Hydration. Water helps your blood carry oxygen and nutrients. Poor hydration slows everything down. Simple rule. Drink consistently throughout the day. Nutrition. Your muscles need building blocks. That means protein. Eggs, yogurt, beans, lentils, fish. Simple balance foods. Try to include protein in every meal. Stress control. Chronic stress affects your hormones. And hormones affect muscle recovery. Breathing, prayer, relaxation, whatever works for you. Calm body, stronger body. Safety and red flags. Now let's talk about something very important. When should you be careful? Speak to a doctor if you notice frequent falls, sudden weakness, dizziness or imbalanced chest discomfort, severe joint pain, uncontrolled blood pressure, diabetes complications, sleep apnea symptoms. If any movement causes sharp pain, stop immediately. There's a difference between effort and injury. And remember, this guidance is for education, not diagnosis. If you're unsure, always get medical advice. The 14-day strength challenge. Now let's turn this into action. Here's your simple plan. Day 1 to 3, learn the movements, focus on control. Day 4 to 7, increase consistency, feel the muscles working. Day 8 to 10, add a few more repetitions, build confidence. Day 11 to 14, stay consistent, focus on quality. At the end of 14 days, repeat your chair stand test. Compare your number. Even a small improvement matters. That number is not a label. It's a starting point. Final message: your strength does not disappear overnight. And it does not come back overnight. But your body is always ready to respond. It just needs the right signal. Walking keeps you active. But strength training keeps you independent. And independence is what truly matters. You don't need perfection. You don't need hours. You just need consistency. Stay patient. Stay disciplined. Stay in control. Take care of your body. And your body will take care of you. This is Dr. Emma Mitchell. And I'll see you in the next video.